Good afternoon, ladies and gentlemen. Welcome to the very first episode of the Backroads and Bandages podcast, where we choose one rural or remote Canadian community to take a deep dive into their health system, nursing supports, and the community itself. My name is Indra Wood, and I'm very happy today to talk to you about my hometown of Flin Flon, Manitoba. So, in today's episode, you will also hear the voices throughout of two nurses from the local community.
My name is Kristi Burke. I'm a registered nurse and I work at the Flin Flon General Hospital in the personal care home.
My name is Andy. I am an RN/BN on the medical and pediatrics floor at the Flin Flon General Hospital in Flin Flon, Manitoba.
And we will also be using the Canadian Association of Rural and Remote Nurses, or the CARN framework, to tell the story of Flin Flon. We're going to take a look at the people, the history, and their culture. We're also going to look at the health system and nursing supports available in the community. We'll assess their healthcare strengths and the gaps in their services provided, and then take a look and propose some innovative solutions for improving the health systems available. And there's a lot of information on the following slides. I will do my best to highlight the key points of each, but please feel free to pause and read at any point throughout the presentation to get a full picture of the Flin Flon community. Now, we'll first take a look at the CARN framework, which is going to be used to analyze and understand the uniqueness of the community of Flin Flon. The most important thing to do so using this framework to analyze is to think about Flin Flon's healthcare challenges in a rural context and with its place in larger society. So, starting at the core of the framework, we're going to discuss the rural people. Now, this is going to be a little bit more generalized. According to CARN, they define rural communities as one of two things: communities outside of commuting zones from urban centers, and with populations less than 10,000 people, both of which Flin Flon fits. 18% of the Canadian population lives in a rural or remote community. However, looking at the healthcare personnel, only 9% of nurses specifically in Canada work in rural and remote communities.
Staffing issues plays a very large role. We don't have the staff that we used to. We're seeing a lot of staff move, a lot of nurses move away from our community. So nurse to patient ratio is different every day, every shift. So on a good shift, each nurse would probably care for 4 to 5 patients. Whereas on a not so good day, each nurse may care for 8 to 9 patients.
Wow.
Yeah, which to me is actually very frightening as a new nurse. Obviously, the more patients I have, the less downtime I have, and the more rushed I feel to get everything completed in a timely manner. And so when I'm providing care to each of my patients, that doesn't feel great because they don't get the care that they deserve, right? I mean, obviously, I still go in and do their assessment, give their medications, do their dressing changes, address any concerns, and provide any treatments that they may need throughout my shift. But I mean, things like sitting and being able to have a conversation with someone who feels lonely and has no family to visit them. Or another example is maybe a palliative patient who is afraid of death and dying. You know, I've had that before while I was in school. Just the little things, right, that you can't always get to, right?
Right.
So if I only have 3, 4, 5 patients on a shift, that allows me to go that little extra mile for them.
We don't have the specialty services. We definitely don't have enough physicians to go around either. That's a bit of a gap, even though we'll get new ones in, but it seems to be a bit of a revolving door. So just when you think you've got more in the group, a few more leave. So to try and phone and get an appointment at the local clinic, you could be waiting a good 4 to 6 weeks for your appointment. It takes a while. The nursing staff is still about, I'd say 50-50. There's a few of us that are lifers. We are here, we're grounded here, we've got some pretty deep roots. And then the other half is definitely that rotating door. And the plan is to stay for a couple years and on they go.
Right.
Or maybe, they'll find someone and end up staying longer.
Right.
Yeah, so it's a bit of a mix, which is nice.
And we can't look at rural communities without looking at it with a ton of nuance, as no two communities are the same. Flin Flon in particular, as one of the things that makes it unique is that it is a border town. One of 2 provincial border towns in Canada, sits on the Saskatchewan and Manitoba border. Now, Just like with urban centers, rural nurses also really look to center care in their practice. To provide patient-centered care, we do so to best meet their individual needs. And doing so also helps build honesty, trustworthiness, and reciprocity in our therapeutic relationships with not just the patients, but the members of our community as well. Nurses in rural communities also engage in a high degree of interprofessional and collaborative teamwork with the health team there, as they're collaborating with physicians, nurse practitioners, emergency medical personnel, and so many more personnel to be able to deliver high quality care to the community. Nurses also often report working with a high degree of autonomy in rural settings, which is great. It helps nurses practice with an extended skill set and gives them tons of opportunities to grow their skills and gain new knowledge and experiences that they might not get in urban centers when they're working in very specialized fields. Nurses in rural communities like Flin Flon are very versatile.
Working in a rural setting is actually really rewarding, and you do get a lot of experience. People may think you don't in the rural setting compared to a busy city, but in a smaller setting, you get to see everything and you're it. In a big city hospital, I've experienced where they have a team for everything. They even have an IV team that would come and start IVs for you. Whereas in a small town hospital, you're it. You're the team for everything. Even Code Blue team. One nurse, one healthcare aide from each area will respond to wherever that Code Blue is happening. So you do hit a lot of skills. You gain a lot of experience in even in different areas, even if it's not exactly where you work.
But it's also important for rural nurses to be prepared despite the low amount of resources they have relative to large urban centers. A specific example of which from this summer being transportation in the face of a mandatory wildfire evacuation that happened rather quickly. So just like with any community, but Flin Flon in particular with a high Indigenous population, it's really important to deliver culturally safe care. One of both the benefits and challenges of being a rural nurse is getting to know your community really well, but the downside of which being that it's very difficult to maintain confidentiality and it can really blur your professional lines, especially when you're in a community where if you don't know everyone, you know someone who knows that person. Now, to take a step outward, we're going to take a look at Flin Flon as a community. It's important to note that when I refer to Flin Flon throughout this presentation, I am most of the time referring to the Flin Flon and surrounding area as well, because while there's about 5,000 people in Flin Flon, there are also additional people in Creighton, Bentonniere Beach, Cottage Country, and Cranberry Portage, as well as 4 other Indigenous reserves in the area and the community of Sheridan as well. So even though they're all within 1 to 2 hours of Flin Flon, they still come to Flin Flon to access our healthcare services. And we do have some demographics for you here, but one I really want to point out is how there is a rather large proportion of people who identify as Indigenous, roughly about 1 in 5 people in the community. Now, when we take a look at their culture, it, like many small towns, really does have a vibrant and unique community spirit. Built on its mining roots, it's a very tight-knit community, and it's also remiss to mention Flin Flon without mentioning the Flin Flon Bombers, who, for the vast majority of people, if you're not a hockey player, you're most likely a hockey fan, where on any given night, about 1 in 5 people in the town are attending the local junior hockey game. There's also tons of community events, festivals through the prominent arts program in the community. That's a huge part of the Flin Flon identity, as well as being close to the outdoors and living in the lake, whether it's summer activities like fishing, boating, swimming, camping, or even winter activities like skidooing, ice fishing. Those are all really big parts of the Flin Flon culture and identity. Taking a look at the politics and government of Flin Flon, they do have a municipal government where Mayor George Fontaine here runs the town along with 6 other council members. Now, what's interesting and starts to introduce a bunch of that nuance into the conversation is the 2 provincial governments that fund and care for Flin Flon. The West Side being governed by the NDP Party of Manitoba and their leader, Wab Kinew, who, fun fact, is the first Indigenous premier in Canada ever. And on the western side with Scott Moe leading the Saskatchewan Party. So Flin Flon falls under Manitoba Health. under the Northern Health Region as well, governs half of the landmass of Manitoba and services around 74,000 people. As for access to healthcare, Flin Flon, compared to a lot of other rural and remote communities, does have pretty good access to its care. Something both Andie and Kristi talked about were how prominent and integrated the public health services and nurses were into the Flin Flon community. There's also the Flin Flon General Hospital offers ER services with their brand new emergency room that opened in 2019, an operating room that does scopes. On the third floor, an inpatient unit doing medical, surgical, pediatric units. They also have 2 palliative care rooms. They have a day clinic located on the 3rd floor and across the street, funny enough. And this is where they also offer their telehealth services, where you can connect to specialists within the province for onboarding, phone calls, and assessments. So you don't have to travel for those. You just have to travel for main appointments or procedures. There are also 2 long-term care homes in the community, the personal care home attached to the hospital and the Northern Lights Manor that's located in a residential area. So for any emergency related needs, there is also the medevac services that will fly you from Flin Flon to Winnipeg, where those flights take between a reported 1.5 to 2 hours, depending on the weather conditions. There's also the Northern Patient Transport Program, which does help provide some funding for people who are accessing essential healthcare services that are not in the Flin Flon community. And here we do have a few pictures of the buildings where the health services are provided. So you can see the Flin Flon General Hospital, where you have the black part of the building, which is the original hospital built in 1938. Then you have the tallest portion, which is the most used part of the hospital, which was built in 1970. And then you have the smaller portion, which is the new emergency room. You also have the Flin Flon Primary Care Clinic, which is located across the street from the community hall. Okay, so I did want to take a moment to talk specifically about the nursing supports that are available in the community, which are primarily provided through the Northern Health Region services. But with nurses being the largest proportion of employees, they really are at the core of all the health services in Flin Flon. They do run the home care program, where it provides essential support to anyone in need. And they also have a very prominent public health program where they do tons of pregnancy or abortion support, any kind of PAP tests or STI testing, sexual health related needs, and other health promotion teachings, which they do in clinic and going into the schools of the community, where they do that and immunizations for the local children. And we already discussed a lot about the hospital, where the majority of nurses work in the community. And there's also the personal care homes, where the nurses there do the hands-on daily care and build up some really great and meaningful relationships with those people too. I couldn't find online the exact number, but there are some nurse practitioners who do practice in the community, where they can diagnose and treat certain illnesses, prescribe certain medications, and these nurse practitioners do operate, as far as I'm aware, out of the Flin Flon Clinic. And then there's also the telehealth service, where nurses are involved in coordinating and facilitating those phone calls to help you connect with specialists outside of the community. Now, there are, of course, assets and barriers to the nursing services provided in the community. Some of the assets being the variety and versatility of skill sets that you get to use in your practice and that you get to learn and build upon throughout your career. So as a new grad nurse, what has your experience been like working in a rural hospital so far?
I can tell you that most of all, it is busy. Our small but mighty unit is very busy right now. This last week has been pretty chaotic for me, but lots of learning experiences for sure. Even though we don't have the full experience here, I guess I'll say, I learn something new every day. Like I'm always going to, like, for the next how many years that I'm here, I'll always learn something new as a new nurse, right? Doesn't matter how many services we do or don't offer here. It's just, I feel that it's a great place to start. And yeah.
And both talking to Andie and Kristi for this podcast, I can really see their heart and their passion in the services that they get to provide to the community members, where you can really tell that they care about putting the patient first and giving the patients their best quality care that they can. They also spoke highly about their workplace family and the interdisciplinary team that they get to work with in their daily jobs, where they do get to build strong relationships with them and the community members that they provide these health services to. As for some of the barriers, like anywhere in Canada at this point. There are a lot of short staffing issues, which can result in a decreased quality of care. Also talking about high workloads and burnout as a result of these short staffing and with a high turnover rate. All right, so for our next step in our journey, I'm going to do a deep dive into Flin Flon as a community and what it means for its place. So part of the identity as well, of course, is being so far away from other population centers, as the next closest hospital is located about an hour and a half south in the Paw, Manitoba. You are about 4 hours away from Prince Albert and about 5.5 from the Saskatchewan capital of Saskatoon. However, from the Manitoba side, they are located approximately 8 hours north of a drive from Winnipeg. So as you can see, distance very much defines Flin Flon's literal place, as it's located nearly in the heart of Canada. As for the weather, it is cold. I can't sugarcoat that there.
Where we live, we get lots of ice and snow for the majority of the year. We see a lot of people falling, so a lot of fractures, people being sent out and then repatriated back to us after getting a broken arm or a broken leg fixed.
And now for a little bit of history of the Flin Flon community. The community as we know today was first settled by a man named Tom Creighton. Local legend has it that in the area, he found a book called The Sunless City, where the main character, whose name is Josiah Flintbatty Floniton, got into a submarine and went to the bottom of a lake to find a lost city of gold. So because the first mining deposit was found in the bottom of a lake, they decided to name the town after him. Although they found that to be a little bit long, so they shortened it to Flin Flon, which is one of the very few, if not only, cities in Canada named after a fictional book character. Now, I'd like to point out as well that the Flin Flon Bombers were founded in 1926. They technically had a team before they had a town. That's how integral the sport of hockey really is to the Flin Flon community, as over the years, they've also produced several NHL players, the most notorious of which is Bobby Clarke and other female players as well, like Flin Flon Female Hockey Hall of Fame inductee Indra Wood. Oh my God, how did that get in there? Anyways, and in 1938, that is when the first Flin Flon hospital was built. Now, I couldn't find exactly when the population of Flin Flon peaked. Sources said that it was sometime in the 1960s, but what is important is that Flin Flon officially gained its city status in 1970, which affected a lot of the provincial police, fire, and health funding that the city was provided. So it kind of plateaued from there and started to slowly decline over time until June 2011, when the smelter, the smokestack pictured next to me here, was officially closed. So that was really the start of the downfall of the mining operations in the community, and also contributed further to the decline of the community itself, because in 2018, significantly, that's when Flin Flon lost their labor and delivery services, as well as their full-time surgical services. So that was a huge blow to the health services that were able to be provided locally. And in June of 2022, the 777 mine was also officially closed, marking the end of the largest mine operation that occurred in town. And also significantly, there was the Flin Flon wildfire that occurred in May and June of 2025 that forced the evacuation of the entire city for the first time and resulted in the loss of about 200 homes in the village of Denier Beach. So I do want to mention that, like, my heart goes out to the people of Denier Beach. And I hope that the recovery process is going well. But Flin Flon remains strong, just like Flinty. Here, we move on and we look forward to a better future. It's also important to touch on the impact of COVID-19 in the community of Flin Flon. And because, if you noticed from the maps earlier, there was one road in and one road out of the community, it was very easy to control the flow of people and traffic in and out of the community, which really helped manage the caseload.
Yeah, COVID was definitely a challenge. And I was now in the best practice educator position. So I was educator for acute care, covering the acute floor, dialysis, chemo, and the emergency room. So I was everywhere. It was challenging because my role, it was relaying all the new policy and rules that were coming out to all the staff. Those things changed every day. Honestly, sometimes every couple of hours. It was hard to keep up. So then it was hard to keep the faith with some of those rules too. And of course, it was a challenge. We had, our share of positive patients, but you really had to put it into perspective. We were actually lucky compared to the big city centers. I cannot imagine what those nurses, healthcare aides, even cleaning staff, everybody went through. We were just a drop in the bucket to that, but it was our own and we had to get through it.
And
Yeah.
still not unaffected by COVID either, because if I remember correctly, there was one case of COVID in March, kind of around when the first wave came, and then everything started to shut down. And then there wasn't another case until September of 2020.
I just remember the masks and the gowns and the shields and the the whole 9 yards.
Would you say you were adequately prepared in terms of resources and funding for COVID?
I think the best they could. Absolutely. We were equipped. There were certain times when it came to a supply chain issue. It didn't have to do with our region per se. It had to do with the actual supply of masks coming in. So there ended up being a short supply at some time. So then we're told, okay, we're going to reuse our masks. You got to put them in a baggie during your break and the this and the that and to get through those times. Yeah, it was, like I said, a lot of different rules at different times. Huge challenge getting the staff on board for everything because you had a full spectrum of the non-believers, trying to get them to follow the rules. And then at the other end of the spectrum, you had the very paranoid people who just about didn't even want to come to work, never mind, and still maintaining that number one focus of we need to give very good care to our patients. Because even though we may have had some positive cases, we still had all of our regular admissions like we normally would. So we weren't just dealing with COVID. It was business as usual with some extras. Yeah.
And when I went home for the summer of 2020, going from Ontario, where they had a high caseload and everyone was wearing masks and taking precautions, to going home, it was very interesting to see people in the community not wearing masks and kind of not believing the severity or the implications of COVID and having people look at me like I was the odd one out for wearing a mask during a global pandemic. So that was a very interesting experience. Again, we'll dive a little more deeply into the Flin Flon fire that impacted the community this summer.
Definitely an unprecedented event for the healthcare system and for the town. I was one of those people that were asked, "Do you think they'll evacuate?" And I would be like, no, we're too big. Flin Flon's never been evacuated. No, they're going to get on that fire. No problem. Well, surprise, surprise. I happened to be working a heavy stretch, so I was on night shift. And the Tuesday night, I got pulled from long-term care to work on the acute ward. And at midnight, one of the managers came up and she was surprised to see me there. It was an emergency manager. And she says, "What are you doing here?" And I looked at my watch. "What are you doing here? It's midnight and you're the emerge manager." But the uppers had met and decided, okay, we need to preemptively evacuate the hospital and the long-term care homes because things are getting close and things are getting iffy. So we did what we had to do, the evacuation packages, phone gave report, we knew exactly who was going where, and then waited and waited and waited. And by the time I left at 8 a.m., not one patient had left from the hospital.
Oh my.
Yeah, it was a little nerve-wracking. So I go home and I'm surprised I got any sleep because I still had one more night shift to go and I had to get my stuff ready by the back door. And when I woke up, usually I'm lounging around and something told me I need to get ready right away. And I was just finishing getting ready and my sister, your mother, called me, panic in her voice was pretty unnerving. She had just gotten a knock on her door from a firefighter saying, "You need to get out now." It was mandatory evacuation at 4 p.m. So I rushed through my stuff in the truck. My night shift didn't start till 7:30 p.m., but I rushed up to work because I know all hands on deck for evacuation. So it was a really eerie feeling. It was a stream of traffic leaving town and I'm trying to get through to go uptown. So I get there and it was a bit of an organized chaos because last year we had a forest fire that was 11 kilometers away. which
Mhm.
was close to home. And so they had us going through all the motions. We had to get evacuation packages ready, and we had to have clothes packed for each resident and whatnot, get ready. And of course, we never had to use it. So this year, it helped us be a little bit more prepared. We had the evac packages ready, but now it was going through with it all. We had everything ready. Once again, waiting and waiting. So when I had gone home to sleep, it's another 8 hours of the day, and still not one patient or resident had been evacuated. So now we are trying to evacuate the town of Flin Flon and the neighboring communities of Creighton and Denair Beach, plus our long-term care people and hospital, all at once. So now it's absolute chaos. So eventually, a school bus showed up from a neighboring community, and it did not have the handicap lift. So their staff, bus driver, and RCMP, we were lifting and loading people onto this bus, and the whole group of them went out to the airport. Some of the staff even flew south with them. I was one of the last 3 staff that stayed behind because we still had a checklist that had to be completed. So we had to do, one final check and search, and we had to lock up charts, lock up the med room, all those extra things. So there was 3 of us that left at 10 p.m. and locked the door behind us. Yeah. So again, another one of those feelings of, the town has left and here we are. It was quite the feeling. So then when it was my turn to leave, I was driving through a ghost town. The town is now empty.
Wow.
And you're hitting the highway to leave. Yeah, it was something else, something I'll never forget.
What would you say would be like the hospital and the region's biggest lesson from this evacuation during the summer?
Definitely a few lessons were learned. The region was very good. One of the good things was about reaching out to us after the fact about our feelings and what we felt could be improved. So we were allowed to voice what we thought went well and what really needed attention. And the biggest one they recognized off the bat was they contacted the program that does the medical flights for the province. We were triaged incorrectly. We were triaged at the lowest you can get. So anytime another call or whatever had come in, they were automatically triaged above us. So that's why that whole night shift and then the whole next day, nobody had left yet because they were responding to other areas of the province that had things come up. So now they know when they contact transport, to make it better known that we need to be triaged at a higher level. And then the other part of that transport is organizing the ground transport. We had no idea how our residents were going to be leaving until we saw a bus show up, and then it was mass exodus. So yeah, a little bit more organization and communication with ambulance and communication with that transport. And the other big lesson takeaway was the other departments were told to drop everything and evacuate with the town. So there we were. And now it's coming at supper time for our residents, and we had no kitchen staff. We had to band together and got them fed, and we should probably pack some lunches to take with them, and having the other departments in the hospital make sure things are covered before they leave. Yeah.
Absolutely. And with the way that the climate has been changing, especially in the past 5, even 10 years in the Flin Flon area with the more drought-like conditions, less precipitation,
Yeah.
more prone to fire, hopefully this wouldn't happen again, but at least with this experience to be a little more prepared.
Exactly. Exactly.
Now to pivot into some of the social determinants of health that impact Flin Flon, there are tons of social supports and services, the most notable of which being the Flin Flon Aboriginal Friendship Center, which is a hub for a lot of Indigenous activities and programs through the community. And as for the language and heritage, the main language in town is English, but there is a significant amount of Cree speakers. There's also Ojibwe, Dene, and Michif that are also spoken locally. As you can see, the average and median income in Flin Flon is about on par with the rest of Canada, as is the employment rate. But again, with the mine in town closing in 2022, it's very interesting to see how the community has developed a 5-year economic plan to build a diversified, sustainable, and resilient economy that's focused on things like tourism, which if you ever want to visit Flin Flon, highly recommend. And there's also a focus on growing a lot of regional education and training, which leads to my next point that there is very prominent education. There are 2 elementary schools, 1 high school, and an additional K to 12 school in the Creighton right next door. And as of the last 10 years, a new school called the University College of the North. They do have 3 programs specifically: a mining academy, a licensed practical nurse program, and a healthcare aid program as well. So there's another way that nurses are being recruited locally and integrated into the community. There are also a lot of houses in Flin Flon, approximately 2,300 homes on the Manitoba side and an additional 200 homes on the Saskatchewan side. As for transportation, though not part of the CARE framework specifically, I did want to make a note of this because the main form of transportation in Flin Flon is driving. So the vast majority of people in town do have their own vehicle or access to a family vehicle, although that is not everybody. There also is an airline, Calm Air, with daily flights to Winnipeg. Other than that, unfortunately, there's no other transportation services as they lost their bus services and passengers train services years ago. So there's really only one of 2 ways to get in and out of Flin Flon. Pivoting more on healthy behaviors, Flin Flon and area does have a higher smoking incidence rate, which is about 50% higher than the national average as of 2013. Not unlike other rural communities where smoking rates tend to be higher, just like sedentary rates as well, which I couldn't find exact information on sedentary rates in Flin Flon, but like other rural communities, it is estimated to be higher than the national average. And as for healthy eating habits, again, I couldn't find specific data on this in Flin Flon, but it does have a notably higher cost of groceries, which can make eating fresh fruits and vegetables and sticking to the Canada Health Food Guide a little more challenging. As for gender, unfortunately, women, particularly Indigenous women, tend to experience higher rates of intimate partner violence. And there is a noted life expectancy difference where women on average tend to live 4 years longer than men, but both expectancies are well below the provincial average. As for some of the legal and political equities, being located on the Manitoba and Saskatchewan provincial border does lead for a lot of administrative difficulties, particularly for the residents on the Saskatchewan side, as there is a noted inequity in the health funding that Saskatchewan residents accessing healthcare in Flin Flon tend to receive, and results in a lot of Saskatchewan residents feeling like they're left behind. As for biology and genetics, it is important to touch on that.
Here up north, we have a large Indigenous population here in the north because we have a lot of reserves around us. The Indigenous population, or those living on reserves, just tend to be higher risk for illness and disease. For example, diabetes mellitus is very common in those patients, and living on the reserves, you don't have as much resources. Right. So that is part of the reason.
And unfortunately, incidences of racism, especially towards Indigenous people, are not unheard of in the Flin Flon community. I couldn't find exact figures, but I do know personally of many people who have filed formal complaints with the Flin Flon General Hospital for racist interactions and experiences. Now taking that final step back in the framework to look at the larger society, looking at social justice, again, with its large Indigenous population, truth and reconciliation is a prominent issue in Flin Flon that the Friendship Center in particular is taking a lot of coordination towards building leadership and to help promote respect, equity, and equal access to all members of society. There's also a prominent missing and murdered Indigenous women and girls movement in Flin Flon. There is also the Walk a Mile in Her Shoes movement, where once a year men will don their high heels and they will walk to support the Women's Resource Center and raise awareness for violence against women. We already have touched on some of the racism and discrimination that Indigenous people in the community do tend to experience, as well of the relative inequity of funding per patient in Flin Flon because of the Saskatchewan government's refusal to fund the hospital in Flin Flon, which is jurisdictionally under Manitoba Health.
We don't get the extra funding and support from Sask Health because we're in the Manitoba facility. So, of course, Saskatchewan Health pays the bill for the Saskatchewan residents we take care of, but we don't get those extra kickbacks. So then that plays a big part in funding our programs and everything too.
Which it makes it so much more complex and resulting in like a lower amount of funding per person in the Flin Flon area.
Yeah, makes it very tricky when you're still servicing those extra people, but you're not getting the extra funding. Yeah.
So, due to that, there is no funding for Flin Flon, Saskatchewan residents, Creighton, Denier Beach, and the three other reserves that are located on the Saskatchewan side of the Flin Flon area, which is why there's that relative inequity in funding. As for the health outcomes of the Flin Flon community, the most recent data I could find specifically comes from a 2008 community health assessment survey, which found the health of people in Flin Flon good, if not better, than provincial averages, which we love that for you. While they did find the rate of respiratory deaths higher in Flin Flon, they found that premature deaths did occur at a lower rate. Now, they couldn't find an exact link, but they did speculate that this was related to the higher rates of smoking in the community, as well as smelter operations, which closed in 2011. This is a bit of a side note, but as a child, I do remember days where there was no wind and the smog was so bad, we would have indoor recess so that we wouldn't have to go outside and breathe in the smoke. And there were other days where we were still outside for lunch, but the smog was so heavy and it just hurt to breathe. So I really hope that doesn't have any long-term impacts on our health. Anyway, as for obesity rates in the community, a Maclean's magazine article published in 2012 found that 2010 data suggested that the Flin Flon area had the fifth highest combined overweight and obesity rate in Canada. In the 2000s, there was some concern for the exposure of heavy metals to the people in the community, as they did find elevated levels in local soils from the smelter emissions. However, they did find that the likelihood of adverse health effects are negligible to low. As a child, I was also part of this study, so I really do hope that those results are true, because that would be great. For the most up-to-date health information that I could find for Flin Flon in general comes from a regional health assessment that occurred in 2019. Now, because Flin Flon is only a small part of this region, I would like you to take these results with a grain of salt because they're not Flin Flon specific. But one thing I did want to point out is that the STD rates, particularly chlamydia, gonorrhea, syphilis, and HIV as well, have significantly increased over time and tend to be at 4 times the Manitoba provincial average. However, in good news, while they found that infant mortality has remained the same, child mortality has decreased over time. While it's still greater than the Manitoba average, this is a trend in the right direction. And they also found that ischemic heart disease and heart attacks have significantly decreased as well. Now, we're going to take a moment to talk about some of the healthcare strengths and gaps that are in the Flin Flon health system. So as for the strengths, the services that are remaining in the Flin Flon community are pretty good, according to Andie and Kristi.
The services that we can provide, we definitely strengthen those the best we can, keep everything very up to date, and try to expand where we can. So our public health does a very good job with the programs that they can deliver and in trying to bring more resources to the town. And same with the hospital. Even though we're limited, we're doing the best we can with what we've got to deliver high quality care with well-trained staff.
Despite not having that fully operational operating room here, for 5 days out of each month, our facility runs endoscopies and gastroscopies. So a physician travels from Winnipeg, and there's a number of nurses who hold what we call endoscopy float positions. So that when it's not scope week, they float to other units, but are always assigned to work in either the theater or pre and post procedure 1 week out of a month. And that 1 week is typically pretty full each month. So having those services in our small community is quite an asset for those who require them, right? And also allows nurses to expand their skills. Additionally, we offer dialysis and chemotherapy treatment to those patients who require them. So it's nice that they don't have to travel to receive those services in addition to living with kidney failure and cancer diagnoses. We also have a fantastic public health team who works out of the Flin Flon Primary Health Care Center, and they offer many different services: reproductive health, vaccinations, home visits, elementary and high school visits, prenatal and postpartum appointments, harm reduction, dietitian services, and so much more.
And I did want to note specifically here some of the upstream and downstream determinant effects on these. Upstream being some of the more broad social, economic, and systemic causes that influence the population. There is tons of economic support from the Manitoba government and Northern Health Region position to be able to continue to provide these services in Flin Flon, especially with the new emergency room that was built in Flin Flon and opened in 2019. On the other side, the downstream determinants, which are the immediate and individual impacts on the community, have found that the easy access to many, if not all of these essential health care services has improved health outcomes for the community members. I also want to point out that the Manitoba government and Northern Health Region do quite a good job of making sure that the healthcare services in the community are funded. The Northern Patient Transport Program does provide a ton of funding for fuel or other miscellaneous transport, even covering flights if a physician deems it medically necessary, and for an escort to come with you, and other accommodations. The Manitoba government, in their 2025 provincial budget, has significantly increased the amount of money to be spent on healthcare services throughout the province. So thanks, WABCanoe. Again, upstream determinants looking at this with the government and regional funding. Downstream, this can really help improve the access to services and the quality of healthcare that the people of the North are able to access, which also leads to better health outcomes. On the flip side, we must acknowledge the loss of services that occurred in 2018, as Flin Flon no longer has labor and delivery services or an operating room full-time.
So the big impact is now expecting mothers with their families, their partners, their family have to now travel to the PAW to deliver. So the timing is everything. I mean, for a new mother, your first time pregnancy, you don't know what to expect. You can't time things perfectly. Even for someone who it's their third baby, you still cannot time things for labor and delivery. So, if they think they're in true labor, they need to get in the vehicle and get down to the PAW. Some even actually choose to go farther, whether it's Winnipeg or Saskatoon. Otherwise, they're to come into the emergency room and get assessed. And then we'll help them and guide them whether it's time to go or maybe it's false labor, But then that being said too, you're wasting precious minutes to get to the PAW because we can ambulance you to the PAW at that point. But even ambulance has their policies and parameters. So even if you're above a certain centimeter dilated, they can't even take you in the ambulance. So now you're in a situation where you are laboring and delivering in our emergency room. That also impacts our staff very much so, because now our emergency department, which is already a highly specialized area, is now having to deal with another very specialized area of care. So after the 5th floor had closed and I was CRN for a number of years there, it was my job to now help set up the ER to deal with these deliveries and do a bit of education and set up the paperwork and whatnot to what it would look like for delivery and emerge.
Is that something that ER staff have received formal training on, or is it something that they've kind of had to pick up on through experience and over time?
No formal training. It was hard for me because, of course, working in a fully equipped, fully knowledgeable maternity ward to now equipping the emerge staff with just the basics. I would get things set up and then I was told, no, Kristi, bring it back a bit, pare it down even more. So it was difficult because it had to just be very simplified for emerge. So it was tricky.
Very interesting, especially since you're approaching with like such a wealth of knowledge and knowing what resources to use in certain situations. So
yeah. And just recently, within the last year, it finally did get approved for the emergency staff to take their NRP training, neonatal resuscitation. So I was so happy to hear that, because it's one thing to be dealing with adults, but dealing with newborns is a whole nother thing. And that was what they were most uncomfortable with. So I'm happy to hear that they are now taking the NRP training. In the community, there was a committee formed trying to make their voices heard about the concern of this program no longer being there for them. And it was a big need. And we may not have been as busy as, the hub of Thompson. And they tried, and, I think their voices were heard, but it's unfortunate that, and this is just personally, I don't think it's ever going to return, because our population of Flin Flon, it has ebbed and flowed a bit, but it is on the lower side. But the other side of this coin is we've now proven that we can live without it for the last 7 years. And that's big to the uppers that are handling the budget, right? But meanwhile, we're not completely living without it. We're delivering an emerge.
Yeah.
Yeah.
Too, it's also very interesting to think about not only how the labor and delivery services service the community of Flin Flon, Creighton, Danair Beach, Cottage Country, but also many of the surrounding reserves, which often have to drive 2 hours or more to come to the Flin Flon Hospital.
Exactly. And because their policy in place is if any emergency presents to their facility, they need to transport to the closest tertiary center, which was Flin Flon. So we would service them as well. And even to this day, if someone shows up in labor, they'll bring them into us if there's enough time.
With the labor and delivery services upstream, there is debate. The Northern Health Region and the Conservative government at the time will argue that funding was not a part of the decision. However,
unfortunately, political rears its head and is a big factor in the medical world. And we ended up with a lot of cuts happening after a certain party got into power there. In Flin Flon, we experienced, I think, the most of the cuts for the Northern Health Region. At first, it was our maternity ward being cut, and then it was the operating room. With no operating room, well, then they didn't need anesthetists. And then they looked at our inpatient beds on our 5th floor and decided, well, with nothing else going on, we're going to shut the whole floor. So it came to a point where my whole floor ended up being shut down. So that was a really hard one to take when the majority of your career is spent in one spot, to just see it, being chopped down bit by bit and then gone.
Which downstream ultimately results in mothers having to travel to other cities to be able to give birth. One of, if not the most significant healthcare events in a woman's life.
For example, a person finds out they're pregnant. I'm just going to walk you through this. A person finds out that they can receive their prenatal care here in Flin Flon at the outpatient clinic with a doctor or a nurse practitioner up until a certain number of gestational weeks. And then the OB/GYN actually travels from the PA here on certain days to see patients until they deliver. Some people choose to travel days or even weeks before their due dates to the town or city in which they are choosing to deliver, but finances are not covered. So gas, accommodations, and meals are to be paid for by the person themselves. So you can only imagine, especially in this day and age, how much that would cost if a person is traveling and then waiting to go into labor or be induced, right? So for those who cannot afford to be leaving in advance, oftentimes will present to the emergency room where hopefully they can be sent out by ambulance or a medevac flight to another facility with those birthing services. But there have been instances in which patients have actually delivered in our emergency room or even in the ambulance on the way to the PA or to the airport to go elsewhere. And I think the scariest part about that is we also don't have an operating room anymore either. So in the event that a person requires a C-section, we don't have an OR. So to me, that's the biggest health need that is still talked about by many, or 7 years later. I know that like the majority of our ER nurses and physicians know what to do now in the event that somebody comes in labor and have to deliver here in the ER because they don't have time to get out of the community. Right. It just happens so often that they know what to do. It's scary to think about what might happen if the person needs to go to the operating room. We've just been lucky so far to not run into that issue, but it's only a matter of time before we do. So that's why it's such a big issue.
As for the OR services, with the departure of the surgeon and the anesthesiologist, they no longer have personnel to be able to operate the OR at full capacity, which downstream results in people having to travel to other communities for minor operations like carpal tunnel to emergent operations like appendectomies or trauma-related surgeries. And the impact that both of these have on the community is a lot of increased anxiety, a lot of additional costs and time to be able to travel for these essential services. Also, notably, there is currently no one in the Indigenous liaison position.
Common issue we run into is caring for patients who only speak Cree and little to no English. Okay. We don't have an interpreter on site, nor do we have an Indigenous liaison worker. The position has been vacant for quite some time now. So it's really difficult to communicate with patients when you cannot understand them and they cannot understand you. And as a result, it is very difficult to provide proper care and treatment. I believe that issue needs to be seriously addressed. Like just last week, I had a patient who didn't speak very good English, right? And it was hard to tell if she was in You could tell she was uncomfortable, but she couldn't really communicate what was going on when you asked her, right? And
Mhm.
so then you don't know, like, okay, like, does she need Tylenol or does she need to go to the bathroom? So
Yeah.
like that's a huge barrier in our northern communities.
Upstream, due to the educational requirements, as well as a lot of the systemic inequities that have historically impacted Indigenous people, downstream, it results in linguistic and advocacy challenges for the patients, as it makes them much more difficult for them to connect with nurses and other healthcare staff to be able to adequately meet their health needs. And ultimately, the impact on the community results in difficulty communicating and building those trustworthy relationships. And it unfortunately erodes a lot of the trust and cultural humility and safety that Indigenous people should be able to receive when seeking healthcare services. Now, considering all of that, I do have 4 main recommendations for innovative proposals to improve the health system in Flin Flon. The first of which is for the community of Flin Flon to advocate to the Saskatchewan government to provide funding for the Saskatchewan constituents accessing healthcare in Flin Flon. Because if they don't go to Flin Flon, they have to go to the next nearest hospital 4 hours away in Prince Albert. Achieving adequate funding from the Saskatchewan government really can help bridge the gap that the Flin Flon community experiences related to health in order to be able to provide sufficient resources and staffing for the community. I would argue that this is a feasible solution, as nurses and community members can both act as leaders and call your local MLA and your local premier in order to advocate for more funding to be able to meet our community's health needs. Again, doing so, you can also raise taxes on the wealthy to be able to allocate those funds towards essential services. And this will also help provide funding for a lot of the other proposals that I have to improve the healthcare system in Flin Flon. It's important to take a strategic approach when advocating for the return of health services and funding in Flin Flon by investing in important relationships with your community, your MLA, and your premier. It's also really important to gather intelligence and enhance your understanding of the issues and the current state of funding in the community so that you can approach with a more concise argument and develop a clear and unified solution to collaborate with provincial leaders to meet the community's needs. It's also really important to fulfill this Indigenous liaison position, as it's critical to supporting Indigenous people who are seeking care. Indigenous liaisons, studies have shown, really act like a linchpin or a coordinator, and it's found that having these Indigenous liaisons really does promote better outcomes for Indigenous people through strong leadership and advocacy, commitment to inclusive and enabling culture, and specific support structures appropriate for Indigenous patients and the staff, especially nurses, who are trying to provide excellent patient-centered care. I think the solution is feasible because what we can do is hire a local individual and train them to best meet the needs of the Indigenous population of the area. And with the increased Manitoba provincial funding and the Saskatchewan funding that the community can advocate for, this can really help provide resources to fulfill this position. My third proposal is to implement formal labor and delivery training for emergency room nurses. Currently, emergency room nurses are able to facilitate the labor and delivery of others in emergent situations, and luckily they have had no adverse outcomes yet. However, there are some training programs that do exist, like the OB in Unexpected Places education program and NRP training that nurses can receive in order to provide better outcomes for intrapartum mothers. The OB education program, I would argue, is feasible because it only really requires a half day of training where nurses can get lectures, skills, and go through simulations to be able to safely facilitate births. And there is also a Noel simulator mannequin available at the University of Manitoba. So since they do have a strong relationship with the University of College of the North, you can absolutely coordinate a few days out of the year to have this shipped up to Flin Flon with an educator in order to provide this training to ER nurses. As with the neonatal resuscitation program, this is also feasible because through the Canadian Pediatric Society, they provide online modules and exams that nurses can take to fulfill the theory side of things, and they can arrange for a skills educator to come, perhaps with the Noel training mannequin, and provide a training day for emergency room nurses so that they can prevent adverse outcomes from occurring with the right training. And lastly, throughout this presentation, you may have noticed a lot of the sources I've used on Flin Flon specifically are over 10 years old. Currently, all of the health data is published regionally as opposed to Flin Flon specifically, which while that does save on cost, it doesn't properly identify or address the health needs that people of the Flin Flon community require. To amend this, I would propose that public health nurses who are very well integrated into the community should collect and publish this Flin Flon specific information to be able to better identify and advocate for community health needs. Studies have shown that accessing this up-to-date information is associated with improved health outcomes for individuals and the community as a whole. And I would argue that this is feasible because it would require funding, which is coming from the Manitoba government and could come from the Saskatchewan government, which we could use to hire additional nurses or care providers to be able to collect this data. Doing so would provide a better idea of the health status and individual and community needs of Flin Flon to be able to improve the health outcomes for all. And that's all, folks. Thank you so much for joining me on the very first episode of the Backroads Bandages podcast. I'd like to extend a special thank you again to Andie Shaw and Kristi Burke, who took time to talk to me about the status of nursing and the health status of the Flin Flon community. A special thank you to my professor, Kim English, for providing this opportunity to do a deep dive into rural health. Here I have some references and some image references as well for everything provided. And a special thank you from Big Papa the cat and Alex, both of my nursing school cats who helped me get through everything. So love you guys. Stay healthy and hydrated.